Today we're going to position for the joint spaces in the lumbar region. They're called the Zygapophyseal joints. And most of the joints in our body make a 30 to 60 degree angle to the mid-sagittal plane. So positioning for this projection, we normally use a 45 degree angle as an average. And we'll start with the patient recumbent. Also, we're going to do RPO obliques, and when you're doing RPO obliques, you are showing the side down. The side down is the side of interest. Obviously, we're going to make sure the patient is changed, and if you have a female patient, making sure that there's no pregnancy, and shield male gonads. Female gonads are not going to be shielded because the shield will be in the area of interest, but you can still shield the patient's femurs. We could use a 14 by 17 lengthwise image receptor. You may also use a 10 by 12 image receptor according to the patient's size. Or you can also just use collimation for sites that have only one size image receptor. A 40-inch SID. And a marker, which I'm going to place inside my bucky on the IR. You can also place it on the table. And you would do both obliques for comparison. I'm going to start with the RPO. Ask the patient to turn towards you, ensuring that the hips and shoulders are in the same plane. You can place a positioning sponge behind the patient to aid in staying in that position. In this case, I'm going to collimate 9 by 14, but I can also do 9 by 12. And I will feel for the patient's iliac crests. And then from that iliac crest, I want to go about an inch to an inch and a half superior. I'm also going to find the upside ASIS on that patient. Very palpable. And from that ASIS, I want to come in 2 inches medially. Not like in my obliquity there, that's more like a 45. And so I want to double check my positioning. You can also ask the patients to bring their arms forward. This way it keeps their shoulder and hips in the same position. You can also lift up your shield here and ask the patient to suspend respiration. So we're going to ask the patient to hold their breath and then breathe. And we will position for the next oblique. Again, we want to do 45 degrees, making sure the shoulder and hips are in the same plane. We're still using a 40 SID. Nine by 14 collimation, and again I'm going to feel for the iliac crest, go an inch to an inch and a half above that, and from the palpable upside ASIS I'm going to come in medially 2 inches. I still have my marker, same side, and I will then again ask the patient to hold their breath and breathe. You can also do these obliques with a patient prone or starting prone, which we're going to demonstrate next. And in this case, the zygapophyseal joints of interest would be the ones on the upside. You can ask the patient to bend their knee, aid them with a positioning sponge, bring their right arm forward and their left one down by their side. Change your marker. And find that iliac crest once again. Go an inch to an inch and a half above that. And this, when you're doing LAO and RAO, you want to find the upside, or you want to feel for the spinous processes, and then center 2 inches towards the upside from there. Again, we're going to ask the patient to hold their breath and breathe. And we will then do the other oblique. Asking the patient to bring this down, arm down, this one up, bend this knee, give him the sponge, making sure shoulders and hips are in the same plane. And then ask the patient to hold their breath and breathe. That's it for zygapophyseal joints of the lumbar spine. If for any reason you needed to show the zygapophyseal joints of L5, S1, the positioning is going to be a little different. You're going to center between the ASIS and iliac crest, and obviously you will bring your collimation in to 8 by 9. And that's it.